Good evening. I wanted to introduce myself, Jennifer Miller from the American Heart Association. I'm the Executive Director here in Westchester County, and I'm on behalf of Westchester County American Heart Association. I want to thank our volunteer leaders and our speakers this evening and give a special shout out to our Live Fierce Go Red sponsor, White Plains Hospital. And without further ado, we're going to start our program. I'd like to introduce Astara Cruz, who will take it from here.
Thank you, Jennifer. Good evening, and thank you everyone for joining us for this important conversation discussing women's health equalities provided by the American Heart Association's Westchester chapter. It is wonderful to be with you all tonight, despite the winter weather occurring outside. So thank you for giving us your time. Tonight marks the event for heart health, as well as Black History Month. And tonight we will be discussing what I'm sure to be an insightful and incredible program this evening. By way of background, the American Heart Association mission is to be relentless for the world of having people live longer lives. Each person deserves that opportunity for a full, healthy life. And as champions for health equality, the American Heart Association pledges by its 100th anniversary in 2024 that the organization will be fully vested in advanced cardiovascular health for all, including identifying and removing barriers to quality healthcare access. One of the many actions that the American Heart Association is taking towards achieving this goal is engaging the community in important dialogue and education. We are so pleased you have joined us this evening. Before I introduce our speakers this evening, I would encourage you all to join us on camera. So feel free to be more connected and dive into our topic of conversation. It is meant to be interactive, so we really want you to use that chat box, ask questions, and chime in. And now, I will introduce Dr. Icilma Fergus. Dr. Icilma Fergus, the Director of Cardiovascular Disparities Initiative at Mount Sinai Medical Center, also plays a role as the attending cardiologist. Dr. Fergus is an active volunteer and leader in our community and currently serves on the American Heart Association's Westchester board. She was previously the president of the Association of the Black Cardiologists. Dr. Fergus is a member of the Alpha Kappa Alpha Sorority Incorporated, Jack and Jill of America, and the Links Incorporated. We're also joined this evening by Dr. Paige Long Sharps. Dr. Long Sharps is an on-site physician advisor for the Optum 360 at University Hospital in Newark, New Jersey. Prior to serving in this role, Dr. Long Sharps serves as the medical director of the Grand Concourse Division of the Montefiore Medical Center, obstetrics and gynecology, and for the women's health for over 15 years. Dr. Long Sharps maintains memberships in the American Cardiology of Obstetrics and Gynecology, the Bronx Medical Society, the National Medical Association, and as well as serves as an active member of Alpha Kappa Alpha Sorority Incorporated, Jack and Jill of America, and the Links Incorporated. Thank you, ladies, for your participation tonight.
A pleasure to be here. Thank you.
Thank you.
So we'll get started with Dr. Fergus. Let's begin. A topic that has been of much conversation of recently, COVID-19. How do you feel COVID-19 has profoundly impacted people with heart disease and disproportionately impacted Black people particularly? It is known that statistics have shown that African Americans with COVID-19 are nearly 3 times as likely to require hospitalization, unfortunately, than their white counterparts. And additionally, people of color are more likely to die from COVID-19, almost to the times, 3 to 4 times the rate of white people. Can you provide us with some insight on why this is happening?
Absolutely. First, I would like to say how pleased I am to be here this evening and have an opportunity to speak on this wonderful panel, Lattes and Leadership. And I'm very thankful to the American Heart Association for providing this opportunity to provide information to our community. So the question relating to COVID-19 and the heart is very profound and very real. And absolutely, you see that communities of color, particularly African Americans and Hispanics, and even indigenous members of the Americas, are likely to have more comorbidities that leads to higher risks. So for instance, there may be a bigger presence of hypertension, diabetes, high cholesterol, renal or kidney failure, weight issues, all of which are likely to result in worse outcomes for COVID when it affects the heart. Additionally, some people may not have all of the access to resources that may be available for certain people. And then there's also the fear of going into a medical institution, or sometimes the distrust of whether they should go in when they could get care maybe at home and be treated better. So I think that many of these are factors that coexist. And related to the last thing that I said, you can relate that to what's called the social determinants of health, which has to do with where one lives, one's access, one's resources, one's gender, sometimes even one's ability to get around or being, disabled. So those are the social determinants of health. And even though there are a lot of comorbidities that I mentioned, I think that some of the social determinants of health certainly played a role to what we're seeing in terms of once they get into the hospital, being sicker and then being more likely to die.
Right. And it's unfortunately that is the case of affairs, but thank you for sharing that. It puts it in much perspective for us. Dr. Long Sharps, one of the most important messages we can communicate to women and men for that case is that you must be your own healthcare advocate, kind of going back to what Dr. Fergus said. As a doctor, how important is that to you?
Thank you, Esther. Like Dr. Fergus, I want to thank the American Heart Association for inviting both of us this evening for such an important topic, so I really appreciate it. In terms of your question as a doctor, how important is it to me? It's especially important, especially as a woman of color. You must be an advocate for your patient to help them advocate for themselves. And it starts with educating the patients by telling them one of the most important tools that they have in their possession is their phone. And that's the power of information. So before visiting a practice, I would tell them to research the physician, research the hospital, find out what the ratings are. How do they treat the patients? It's sad, but it's true that a hospital, a practice, it's a business. And without patients, they can't survive. So word of mouth, it used to be the traditional way, but now we have reviews, we have social media, and all these things can make or break a practice. I just recently learned from a nurse colleague of mine that there's even an app called Earth, like birth, drop the B, and the B was dropped for bias. And that's one that you can use for rating a practice. It's like a Yelp-like review, and you can use it to rate hospitals and physicians, and it's made by and for Black women and birthing people of color. And I believe movements like this will be the start of really revolutionizing the way people of color are treated. Again, it leads back to hitting hospitals and physicians in their pocket. And just think how the Montgomery boycott changed the public transportation system. Next, I would tell patients to educate themselves on themselves. For example, if you're undertaking prenatal care, start by educating yourself on the different trimesters, what exams, what tests to expect. so that when something is a little off and not aligned with maybe what you've read, the patient can be advocate for themselves and ask the doctor, hey, I thought I was supposed to have such and such, and this is not in line with what I read. And it's not that you're being confrontational or you're being combative, but you're just being more aware and advocating for yourself. You should also compare notes with other pregnant women, especially if they have similar medical issues as yourself, particularly diabetes and hypertension. It's so important that patients feel that they can trust you, that they can be open and transparent with you, because this will allow them to know that you have their health outcome first and foremost. Some physicians might even be offended if a patient asks for a second opinion, but I actually encourage it. Again, the patient is the director of the team. So with that, communication is key, and they should feel that they are important and that all their questions are met. And this is especially important tying back to patients of color, because we know it's all over recently about the biases and the racism within the healthcare system. So patients of color can already come from a position of distrust, like Dr. Fergus just mentioned. So it's even more important to aid them in advocating for themselves. And that's how I would end that right there. I have more to say, but I'll circle back.
I think that's enough said, Dr. Long Sharps. I mean, your message was powerful. Takeaway being power of information, educating yourself on yourself. Dr. Fergus, kind of segueing into this next point of topic, statistically, we know that Black women are predestined for certain illnesses and potentially, in case point example, I should actually say, suffer from high blood pressure more than other women. What do you think is the reason for this? And what role does that play in why more Black women are having cardiovascular diseases than women of other demographic groups?
Asara, I think that's an excellent question. First, let me say that over 90 million people are suffering from hypertension, which is a silent killer. So sometimes before you know it, something may happen adversely. Then you realize that, you do have high blood pressure. So let me just refer back to something that Dr. Paige Long Sharps just said before in terms of being your own advocate. When you get on an airplane and something goes wrong, they say, first put on your own mask, and then you can help others. And you ask, why are Black women more likely to suffer from hypertension? Well, because of a myriad of issues, but I think that one of the things we need to do is to put on our own masks. And for instance, you mentioned that myself and Dr. Paige Long Sharps, we're a member of many different organizations. And so, you have to find that time to spend a little time and take care of yourself while managing all of these other things that one might be doing. However, when I see my patients, I do ask them to get involved in doing something for others, because actually that has been shown to help. But now getting to the scientific reason why African-American women may be more likely to suffer from hypertension compared with others. So that you may know it, the new guidelines that came out from the American Heart Association and the American College of Cardiology, your blood pressure should be 110 to 130 over 70 to 80. And some people don't recognize that. Once you start having a blood pressure above 130 over 80, that's the first stage of hypertension. And at that level, you can already begin to have end organ damage. Within certain communities, the messages may not be very clear. Some of the primary providers may not be necessarily up to date on the latest evidence-based clinical guidelines. They may still be going with the 150 over 90. That's one reason. Number two, again, we talk about access, and unfortunately, far too many people don't necessarily have access or resources to, make sure that their blood pressure is being checked. They may not have a blood pressure monitor at home. Another component certainly has to do with the cardiometabolic risk factors that all tie in together with each other. So that would be weight. 4 out of 5 Black women over the age of 30 have issues with managing weight. They're more likely to have issues with being overweight compared with other groups. And that leads to, of course, continuing to have high blood pressure, and then you develop diabetes. And diabetes is a growing epidemic here in the United States. And in some communities, almost 18% of individuals have type 2 diabetes. So that has to do a lot with sometimes the things that you eat. And so, we know that for diabetes, you're watching out for blood sugar and carbs, but for hypertension, you want to watch out for sodium. And the general population of the American Heart Association, American United States, recommends 2,500 milligrams or less for sodium intake. But for African Americans, it should be 1,500 milligrams or 1.5. If you can get closer to that, then you're able to manage your blood pressure more. So reading food labels and eating fresh, healthy foods with fiber and buying things versus eating processed foods will help to reduce sodium. You may not realize it, but some of the foods that are supposedly healthy, let me give you an example. Let's just say Cheerios. Again, that has to do with portion sizes. And if you're really trying to get below this 2,500 milligrams per day, a bowl of Cheerios in the morning can give you like 800 milligrams of sodium. So you really have to watch what you're intaking, watching that diet. And genetically, some African Americans are more predisposed to what we call being salt sensitive. So simply having a little bit more sodium in their body can allow your blood pressure to be elevated. So again, watch your sodium, watch what you eat, exercise, watch your weight, make sure that you're getting rest, make sure you're getting enough hydration. And remember, put on your own mask first, because if you do so, then you can really help others. And then the last piece is be physically active. And the American Heart Association recommends that on most days of the week, you should do about 30 minutes of exercise. And that doesn't mean spending an arm and a leg at a gym. Anyway, we can't go to a gym right now, so you can walk and exercise. You can clean your kitchen floors or your kitchen cabinets. You can dance, you can stretch, you can get bands, you can do jumping jacks, anything that allows you to move more, and try to get 30 minutes on most days of the week. That would be helpful. So for many of those reasons, African-American women are more likely to have elevated blood pressures compared with their other counterparts. Shovel
Thank
snow.
you.
Megan said
Yes.
shovel snow, and you can do that too.
Right. And there's
Today.
plenty of that to shovel tonight. Thank you, Dr. Fergus. I think you provided a great starting point. What I got out of that was that we need to get active. We definitely need to watch our weight and what we eat. And did I hear correctly that our daily sodium intake should be 1,500 milligrams?
You should aim for that if you have high blood pressure. It's very difficult to do. The general recommendation for all Americans is 2,500, but for African Americans, because of that salt sensitive gene, you should try to aim towards the 1,500, which is very hard to do. And I forgot to mention the DASH diet. So you can go online and download the DASH diet that helps you to, manage your sodium, and that can actually bring your blood pressure down by a number of milligrams of mercury.
Perfect. Thank you. I'm taking notes. There's a lot of good information being provided. We'll go into the next question. Thank you, Dr. Fergus. For Dr. Long Sharps. We have heard many sad stories within our own community and even on TV in the media. And one of the things I would like to also discuss tonight before we get away with the program is women's health and inequalities, because it's an intersectional topic. And for many women, pregnant or otherwise, there are a lot of health issues that intersect. We've seen the stories of high-profile African-American women, such as Beyonce and Serena Williams, come out and share their life-threatening complications as it relates to their pregnancies. Can you give us some thoughts on why Black women are suffering at such a high risk of dying from pregnancy complications?
Yes, I have lots of thoughts,
Right.
lots of facts. We'll start with knowing that Black women die 3 to 4 times more than white and Latino women. We know that location matters and it transcends class. So even in New York City, Black women are dying 8 to 12 times more than their white women, regardless of their education. And it's not just women of color. The overall rate of pregnancy-related deaths in the United States has climbed tremendously. Just the last report came out, 700 women died last year just in maternal mortality. So the numbers are high, especially for an industrialized country. But I think before we can even really dive into why Black women are at high risk and dying from pregnancy complications, we have to address the elephant in the room. And that's what we've been hearing in the news. I'm thankful the Biden administration is now delving into the health inequities, the implicit bias, and then the racism, within the healthcare system. Like I said before, there's already a level of distrust within the Black community. And we know that racism plays a tremendous part in why women are dying. We know that education and money alone, like you just mentioned with Beyonce and Serena, doesn't save you from not having complications or issues during your pregnancy. But we have to start by acknowledging that there is structural racism, there's discrimination, and all of this contributes to the disparities in the maternal morbidity and mortality. We have to address it, and we have to know our history. And particularly in OBGYN, we have to know the history of how things started. We have Dr. Sims, who is the so-called father of obstetrics. He has about 4 statues throughout the United States. And it's over 400 years ago, he was using slaves for experimentation in perfecting his surgeries and his procedures, mostly all the time without anesthesia. I mention this because this ties into a recent study in 2016 by Dr. Hoffman and her team. And she asked over 200 residents their thoughts on Black patients. And they came out with 4 things in particular. One, that Blacks have thicker skin. They felt that, these are medical students, that Blacks have thicker skin than other race. Black nerve endings are less sensitive. Black people's blood coagulates more quickly, and Blacks age more slowly than whites. And so we see how this affects patient care and decision-making, because if you feel that your tolerance for pain is much higher, then you won't give a woman adequate pain management. You might not offer her epidural during delivery. So when we address that there's these disparities and these ways of thinking, then we can begin to attack why are they dying in the first place. We also know it's a lack of poor quality of care, especially in lower socioeconomic levels and areas. And we know that Black women are undervalued. They're not monitored as carefully as white women. And when they do present with symptoms, they're often dismissed. Again, we can see from the study how this ties in. The bias and the stereotyping, regardless of your color, it impacts the level of care that you receive. There's also a study that was put out with Dr. Clark and Higgin, tying racism to high stress levels, hormone levels, high heart rate, chronic inflammation, and high blood pressure. And all of this leads to heart disease. And I mentioned this is the American Heart Association talk, but heart disease and stroke are the leading causes of maternal death. And so women who experience pregnancy-related health problems, including preeclampsia, they have a higher risk of developing heart disease following childbirth. And again, this ties into the mortality and morbidity for pregnant women. And it's important that we say that these issues are not only ending once they deliver, and not even 6 weeks postpartum. 1/3 of complications occur between 43 and 365 days after, particularly heart disease. So that's why it's so important to monitor women beyond 6 weeks. And lastly, it just comes down to what we all took a vow as physicians and anybody treating patients, and that's to do no harm. We just need to show that we care. So my motto when I started and what I continue is, if I treat every patient as if they're my mother or my sister, I can't go wrong.
Oh, thank you, Dr. Long Sharps. Really do appreciate that. And I am feeling in a better place to know physicians such as yourself are out there advocating for women of color. Thank you for that. That was very helpful for us to connect the two and be able to, again, be better advocates for ourselves. One last question I have, I'll present this to Dr. Fergus. So we've heard so much about, health equalities, access, disparities. And as a member of the American Heart Association on the board, can you speak to what you know to be true about the American Heart Association, how they're addressing these health inequalities nationally and locally?
Sure, absolutely. And I'm getting a reminder that we only have 3 minutes left. This is such a powerful conversation that I do wish we had more time to delve into it. But the good news is that the American Heart Association continues to do many things around the nation, in fact, around the world, to address these inequities in care. In fact, starting with this conversation today is a beginning. There's a lot of money that's invested in a number of programs. And one of them that I'm very excited about is a program that looks at where people live, because believe it or not, your zip code can actually mean your death, or it can mean your survival. So there's some programs that are being done. One, of course, is the Social Impact Fund, and then the associated Bernard J. Tyson Impact Fund that really focuses on raising and putting a lot of substantial funding into the communities to help local entrepreneurs so that they can build and begin to treat and provide for the local communities, so that we have more access to healthy foods and all the things that are needed so that we reduce those social determinants of health. Advocacy. A lot of policies are being implemented that help to dismantle residential segregation and its economic, educational, employment, and environmental consequences. Future policies have to, and I mean begin now, begin to eliminate inequities in access to healthcare, because at the most basic fundamental premise, as said by Martin Luther King, of all forms of inequity, inequity as it relates to healthcare is the worst of it all. So doing this advocacy will really be helpful. The American Heart Association also intends to advocate and to build and expand upon its numerous volunteers, to have millions of volunteers and staff who are all dedicated to this end. And it starts by all of you tonight. If you want to volunteer for the American Heart, and if you want to contribute in some way, I'm pretty sure that they would welcome your input, your suggestions, donations, whatever you can, so that this great work can be continued. And so, because unfortunately we're out of time, I'm gonna have to end there. And again, thank you all very much for attending. Thank you, Estara, for these very profound, important, and impactful questions. And thanks, Jen, Megan, and all of the American Heart Association for making this come to fruition. Thank you so much.
Thank you, Dr. Fergus. I've seen some very incredible questions coming in, and because we're running out of time, I do so apologize, but I'm sure that the American Heart Association leadership would definitely get to those questions to try to get that information out to those who registered. We would like to, before we conclude, let's just put it there, I want to keep my manners. Before we conclude this evening, I will ask you to do one thing. The American Heart Association cannot reach its goal for health equality without collaborating with leaders in the community such as yourself. Jennifer Miller, Megan Lucas, the American Heart Association staff and partners will be following up with you in the weeks ahead to explore ways in which you can get involved for Go Red for Women and make an impact. Again, thank you, Dr. Fergus, Dr. Long Sharps. This has been one insightful conversation. I wish we had more time to discuss. But we'll close up for this evening and hope to look for more conversations such as this in the near future. Have a wonderful evening and happy Black History Month.
Thank you.
Bye.